All right, today we're going to pull back the curtain on cosmetic medicine. We're getting past all the marketing fluff to show you the hardcore, high stakes science that separates a fantastic result from a really serious complication.
So, you probably think this whole field is just about looking good, right? Well, at its core, it's really a game of millimeters. We're talking about a world where precision isn't just a nice to have, it's literally everything. Okay, take a look at this number. Less than or equal to 25%. What on earth could that mean? It seems kind of small, but trust me, it is the absolute key to one of the most popular procedures out there. And there it is. In hair transplantation, if a surgeon harvests more than 25% of the hair from your donor area, you could end up with a permanently thinned out, kind of moth-eaten look. See, this isn't just art, it's straight up math and biology. And if you get it wrong, the consequences are permanent. So let's start with hair. You hear a lot of buzz about these so-called liquid gold therapies. But what does the actual science, the real evidence, have to say?
First things first, let's get on the same page. PRP, or platelet-rich plasma, is where they take your own blood, spin it down to concentrate the platelets, which are just packed with growth factors, and then inject that right back into your scalp. The whole idea is to wake up those sleepy hair follicles. Sounds simple, right? Well, the devil is always in the details.
Now, check this out. This is a great comparison between PRP and a newer therapy called GFC, or growth factor concentrate. Now, GFC is often marketed as being somehow purer or better, but, and this is a big but, the 2024 guidelines from the top hair restoration society say PRP is what's recommended. Why? Because it's backed by way more solid, high-level scientific evidence. It's a classic case of marketing claims getting way ahead of the medical consensus. So, what can you actually expect if you get a properly done PRP treatment? Well, the best data we have points to about a 20 to 30% increase in hair count after 6 months. Look, it's not a miracle cure that's going to give you a full head of hair overnight, but that is a significant, scientifically proven improvement. But here's where it gets really serious. This is a critical safety warning. For some conditions, like what's called active scarring alopecias, PRP is an absolute never event. The very same growth factors that help in normal hair loss can actually pour fuel on the fire of inflammation in this condition, making everything much, much worse. This is exactly why getting the right diagnosis from the start, well, it's everything. Okay, let's keep going and see how the same idea, this obsession with precision, plays out with surgery and lasers. This is where horde numbers, like percentages and wavelengths, are completely non-negotiable for getting a good, safe result. Hey, remember that 25% from the beginning of our talk? Well, here it is again. You see, there's a common belief that you can get away with harvesting up to 30%. But the gold standard guideline is crystal clear. You go over 25% and you are seriously risking a new problem, thinning in the exact place you're trying to get hair from. It's a perfect example of how sticking to the evidence-based numbers protects you. Now, let's switch gears to lasers. You know, the magic behind laser hair removal is this really cool physics principle called selective photothermolysis. I know, it sounds super complicated, but the idea is actually pretty simple. You use a very specific wavelength of light that gets soaked up by a target, like the dark pigment in a hair follicle, to heat it up and destroy it, all while leaving the skin around it totally untouched. And this is where that physics becomes so important. For darker skin tones, you've got melanin in both the hair and the skin. So if you use the wrong tool for the job, like an alexandrite laser, it can't really tell the difference, and you've got a much higher risk of burns or pigmentation changes. But a diode laser, it uses a different wavelength that's way more selective for the hair follicle, which can lower the risk of those complications by up to 50%. It's not a preference, it's just physics. So, I've got a question for you. Why is trying to do laser hair removal over a tattoo a massive, absolute never event? Well, think about it. The laser sees that dark tattoo ink as a target, just like it sees pigment in hair. It's going to absorb all that energy, which can cause the ink to basically explode under your skin and lead to a very severe burn. This isn't just a suggestion, it's a law of physics you do not want to break. All right, next up, injectables. We're going to go beyond the basics of Botox and fillers and talk about the anatomy of the face's danger zones, where, you guessed it, a single millimeter can make all the difference. So, let's look at the forehead. There is a very specific safe zone for Botox injections, about 1 to 2 centimeters above your brow bone. Now, if an injector goes any lower than that into the danger zone, the toxin can start to spread downwards, and the result of that tiny mistake? Well, this. A droopy eyelid that could last for 3 months. That one little centimeter is the only thing standing between the result you want and a really obvious complication. It all comes down to knowing the anatomy, period.
Now let's bust a common myth about fillers. You might have heard of this technique called aspiration, where the injector pulls back on the syringe to check if they're inside a blood vessel. But here's the thing. The latest expert consensus is very clear. This technique gives a false sense of security. It fails to detect a vessel way too often and simply cannot be the only thing someone relies on to prevent a disaster.
Which brings us to the most important question of all. What happens when something does go wrong? This right here is the gold standard emergency plan for a vascular occlusion. That's when filler blocks a blood vessel, and it's one of the scariest complications. A top-tier practitioner doesn't just cross their fingers and hope for the best. They have a clear, practiced, immediate plan of action ready to go at a moment's notice.
So, we've looked at the science, the numbers, the risks. What do you do with all this information? It's all about empowering yourself to become what we're calling a gold standard patient.
And here it is. This is your personal checklist. These are the questions that cut right through all the sales pitches and get to the heart of the science. You're not just a passive patient anymore. You're an informed partner in your own care, and you're now equipped to find the people who really do operate at that highest evidence-based standard. At the end of the day, this is the main message I want you to take away. Excellent, safe results in this field are never, ever an accident. They are the direct result of a deep understanding of the science, a respect for the data, and an unwavering commitment to following strict, evidence-based protocols. Every patient, every time. And that leaves us with one final thought. Maybe the most powerful question you can ask isn't, what should I get? But instead, what's your plan for when something goes wrong? Because any practitioner who can confidently and clearly walk you through their emergency protocol, well, that's someone who truly gets that this isn't just about aesthetics. It's about science, and above all, it's about your safety.